Hi Mama, welcome to the 22-week pregnancy update. So yes, today I'm 22 weeks pregnant, and if you're watching this video, I guess you are too. Congratulations, you've already come so far. We are past halfway there already. This is very, very exciting. So in this update, we're going to talk about baby and mama and what is happening with us and how to support mama and therefore support baby. Let's talk about our baby. Our baby is around 28 centimeters long and weighs around 450 grams. And if we compare it to a fruit, it is the size of a papaya. So what is happening with our little papaya baby? The facial features are becoming more and more distinct. You can now see the eyelids quite well, you can see the nose quite well, you can see the lips and the eyebrows. So our little baby is really looking like a little baby, so like a newborn. Their taste buds are developing, which means that they can taste the amniotic fluid which they are swallowing. And this therefore means that whatever you eat will then not only go through the placenta, those nutrients go to baby, but they will also be able to start tasting these tastes that you taste in one way or another. So it is highly recommended to have a rich diet and a variety of foods that you are eating so that baby can start tasting these different tastes and therefore not be a picky eater in the future. Baby can also hear. Since a few weeks, your baby can also hear sounds not only on the inside, but also on the outside. They will now be able to recognize your voice and recognize daddy's voice, or recognize some other sounds that are occurring common and often around them when they are awake. Baby is moving a lot. So your little ninja there is kicking, is stretching, is boxing, and these movements are more coordinated. And you will definitely feel them, especially when you are more relaxed. So maybe in the evenings, for example. And then the new improvement of our tiny little human beings is connected to the lungs. The air sacs are now developing and the baby is beginning to practice breathing movements. So this does not mean that the baby is breathing, but those movements are starting to be practiced by baby. The baby is still receiving the oxygen from the placenta, however. So quite a lot happening with our baby papayas. Let's see what is happening to mom. So because you are growing, because baby is growing, therefore you are growing, you're pumping a lot more blood through your body, and to support the rapid growth of baby, your appetite might be increasing. So just remember to eat healthy, to eat smaller portions. Those are better for potential heartburn or for easier digestion. You might be feeling back aches or pains around kind of the lower back or the hips, as well as the round ligament, which is here. And this is obviously due to the growing belly. What is recommended is to do stretching exercises and to strengthen this area. So strengthen the glutes and strengthen the legs that are supporting the growing belly, as well as remember about your posture. So the strength of the upper body is also super important, and remaining straight with the shoulders back and down. Just be mindful about that as well. You might see some stretch marks appearing on your breasts, around your hips, around your belly. To help that, you can moisturize your body. However, unfortunately, a lot of this is due to genetics. So if your mum had stretch marks when she was having you, then it is probable that you will also have stretch marks. Around this time, you might start feeling Braxton Hicks once in a while. And this is completely normal. These are practice contractions that your body will start doing. So this is normal if it happens once in a while, not too regularly and not too often. If it is happening more often and you are concerned about it, then do go to your doctor to have this checked so they can advise you maybe on a medication or maybe tell you to do something differently in your daily life. So what should we remember about is hydration. Hydration is key. Drink a lot of fluids, a lot of water. Important are meals, so healthy meals, iron-rich meals, and protein-rich meals, as well as omega-3 fatty acid-rich meals. So those will be your fish in the case of omega-3. Protein-wise, those will be eggs, lean meat. And when it comes to the iron-rich foods, again, this is going to be the red meat, as well as dark leafy greens. What else? When it comes to sleeping, to support your belly, which is growing, and again, the shifting gravity, center of gravity, and therefore the whole body moving to your side. The best way is to sleep on the left side to promote that the blood is circulating well during your sleep, as well as keeps coming to the baby accordingly. And it is advised to sleep with a pregnancy pillow. So I did a separate video about pregnancy pillows and which one is the best and how to use such a pillow if you don't have that one, the other ones as well, to correctly use it so you get a good amount of sleep, as well as good recovery, and that your body is in the right position during the night. So that's it for me for today. Thank you so much for joining me. I hope you've joined the Great Pregnancy Challenge and you're working out daily with me, or if you can't work out daily, then you can combine the workouts into 2 or 3 at one time and train 2 or 3 times a week. This is super important in pregnancy, to keep moving, to stay fit. This will help you in labor. This helps baby develop. This will help your body also feel stronger and more comfortable while it is going through all of these changes. So I hope to see you in another workout video already tomorrow. So we're going to have 22 weeks and 1 day tomorrow. Have a great one for now, and I'll see you next time. Bye!